Hi everyone and welcome to my channel with BB. This video of mine is about vaginal yeast infection. Well, it's a fungal infection that causes irritation, discharge and intense itchiness of the vagina and the vulva, the tissues at the vaginal opening. Also called vaginal candidiasis, vaginal yeast infection affects up to 3 out of 4 women at some point in their lifetimes. Many women experience at least 2 episodes. So this is a very common illness. Okay. A vaginal yeast infection is not considered a sexually transmitted infection, but there is an increased risk of vaginal yeast infection at the time of first regular sexual activity. There is also some evidence that infections may be linked to mouth to genital contact, oral genital sex. Medications can effectively treat vaginal yeast infections. If you have recurrent yeast infections, 4 or more within a year, you may need a longer treatment course and a maintenance plan. Earlier on this channel, I have already uploaded a video about vaginal yeast, short video about vaginal yeast infection. Today, I am going to present this illness in detail. Okay. Now, first of all, let me tell you the symptoms. Well, yeast infection symptoms can range from mild to moderate and include itching and irritation in the vagina and vulva, a burning sensation, especially during intercourse or while urinating, redness and swelling of the vulva, vaginal pain and soreness, vaginal rash, thick, white, odor-free vaginal discharge with a cottage cheese appearance, as you can see in the image which I am posting. Okay. Also, there may be some watery vaginal discharge. If there is a complicated yeast infection, then you have severe signs and symptoms such as extensive redness, swelling and itching that leads to tears, cracks or sores. If you have 4 or more yeast infections in a year, then it can also become complicated. Your infection is caused by a less typical type of fungus, or if you are pregnant, or if you have uncontrolled diabetes. Okay. Well, on this channel with BB, I have already posted a very detailed video about diabetes in which I have told the complete guidance. You can see that video. Okay, that is very informative. Also, if your immune system is weakened because of certain medications or conditions such as HIV infection, that can also lead to yeast infections. You should make an appointment with your doctor if this is the first time you have had yeast infection symptoms, or if you are not sure whether you have a yeast infection, if your symptoms are not relieved after treating with over-the-counter antifungal vaginal creams or suppositories, or if you develop other symptoms. Okay. Now let me tell you the causes. Well, the fungus Candida albicans is responsible for most vaginal yeast infection. Your vagina naturally contains a balanced mix of yeast, including Candida and bacteria. Certain bacteria known as lactobacillus act to prevent an overgrowth of yeast, but that balance can be disrupted. An overgrowth of Candida or penetration of the fungus into deeper vaginal cell layers causes the signs and symptoms of a yeast infection. Overgrowth of yeast can result from antibiotic use, which causes an imbalance in natural vaginal flora, pregnancy, uncontrolled diabetes, an impaired immune system, taking oral contraceptives or hormone therapy that increases estrogen levels. Candida albicans is the most common type of fungus to cause yeast infections. Yeast infections caused by other types of Candida fungus can be more difficult to treat and generally need more aggressive therapies. Now I'll tell you the risk factors. Factors that increase your risk of developing a yeast infection include antibiotic use. Yeast infections are common in women who take antibiotics. Broad-spectrum antibiotics, which kill a range of bacteria, also kill healthy bacteria in your vagina, leading to overgrowth of yeast. Increased estrogen levels. Yeast infections are more common in women with higher estrogen levels, such as pregnant women or women taking high-dose estrogen birth control pills or estrogen hormone therapy. Uncontrolled diabetes. Women with poorly controlled blood sugar are at a greater risk of yeast infection than women with well-controlled blood sugar. Impaired immune system. Women with lowered immunity, such as from corticosteroid therapy or HIV infection, are more likely to get yeast infections. Now I'll tell you some preventive measures. Well, to reduce your risk of vaginal yeast infection, wear underwear that has a cotton crotch and doesn't fit too tightly. It might also help to avoid tight-fitting pantyhose, douching, which removes some of the normal bacteria in the vagina that protect you from infection. So the women who are fond of douching, it's not encouraged to do this douching, okay, because it is harmful, okay. Also, if you use scented feminine products, including bubble bath, pads, and tampons, then there is an increased risk of yeast infection. Hot tubs and very hot bath also is a risk factor. Unnecessary antibiotic use, such as for colds or other viral infections. Staying in wet clothes such as swimsuit and workout attire for longer period of time can also lead to higher chances of this yeast infection. Okay. Now I will tell you about the diagnosis. Well, when the patients come to us, we ask questions about your medical history. This might include gathering information about past vaginal infections or sexually transmitted infections. Also, we need to perform a pelvic exam. Your doctor examines your external genitalia for signs of infection. Next, your doctor places an instrument, that is speculum, into your vagina to hold the vaginal wall open to examine the vagina and cervix, which is the lower narrower part of the uterus. Also, we may order some test for the vaginal secretion. We may send a sample of vaginal fluid for testing to determine the type of fungus causing the yeast infection. Identifying the fungus can help your doctor prescribe more effective treatment for recurrent yeast infections. Okay. Now I'll tell you the treatment of yeast infections. Well, treatment for yeast infections depends on the severity and frequency of your infections. For mild to moderate symptoms and infrequent episodes, we might recommend short course vaginal therapy. Taking an antifungal medication for 3 to 7 days will usually clear a yeast infection. Antifungal medications, which are available as creams, ointments, tablets, and suppositories, include miconazole, which comes with the name of Monistat 3, and terconazole. Some of these medications are available over the counter and others by prescription only. Then we may also prescribe single dose oral medication. Your doctor might prescribe a one-time single oral dose of fluconazole that comes with the name of Diflucan. Oral medication is not recommended if you are pregnant, so be careful if you are pregnant. To manage more severe symptoms, you might take 2 single doses 3 days apart. Also, you should see your doctor again if treatment does not resolve your symptoms or if your symptoms return within 2 months. If your symptoms are severe or you have frequent yeast infections, your doctor might recommend long course vaginal therapy. Your doctor might prescribe an antifungal medication taken daily for up to 9 weeks, followed by once a week for 6 months. We may also advise multi-dose oral medication. Your doctor might prescribe 2 or 3 doses of antifungal medication to be taken by mouth instead of vaginal therapy. However, as I told you earlier, this therapy is not recommended for pregnant women. Then we have an azole-resistant therapy. Your doctor might recommend boric acid, which is a capsule inserted into your vagina. The medication may be fatal if taken orally and is used only to treat Candida fungus that is resistant to the usual antifungal agents. Okay. There is no role of any alternative medicine therapies treating yeast infections. Some complementary and alternative therapies may provide some relief when combined with your doctor's care. You should talk to your doctor about what alternative treatments for vaginal yeast infection may be safe for you. Normally we do not recommend any alternative therapies. On this internet and YouTube, there are so many people who pretend to be doctor, and they just keep on advising some this herbal and local herbal medicine, which they claim that they are very natural and they don't have side effects, but actually this is not true. The people who recommend unregistered or unlicensed medicine are really, they just want to increase their YouTube views. So do not fall for those people. Okay, always ask for the help from a qualified medical professional, such as myself. I'm a qualified doctor and I have a license to practice in different countries. I have been practicing in Western countries, as I've been practicing in Asian countries as well. Okay, If you have any question about vaginal yeast infection, you can post in the comment section. Okay, and there are so many videos on this channel, and if you have an illness or your loved one is suffering from any illness for which video is not there, you can ask me in the comment section, and as soon as I find a time, I'll try to post a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.